Welcome to Think Your Health, and I'm Dr. John. On this channel, questions and problems regarding your health are answered. What is Clopidogrel? Clopidogrel is a prescription medication. The brand name is Plavix. Your doctor would tell you that this is an anti-platelet medication. What does that mean? Or what does anti-platelet mean? Well, platelets are blood cells that help blood clot. That would mean if you used Clopidogrel, it prevents your platelets from sticking together into blood clots. It makes your blood, if you will, thinner. In this way, this medication can lower the risk of a heart attack or a stroke. How does Clopidogrel lower the risk of a heart attack or a stroke? Most heart attacks are caused by a blood clot forming in vessels supplying the heart with oxygen and nutrients. Most strokes are caused by blood clots in the vessels supplying blood to your brain. By using Clopidogrel, we can lower the risk of these very frightening events. What is Clopidogrel used for? Like I said, it is used to lower the chance of a heart attack. It is also used to lower the chances of a stroke. It can be used after a stent implant or other vascular procedure. Your doctor might direct you to take this medication with aspirin for many months or even years, depending on the type of stent or procedure. It can be used off-label if you have compromised circulation problems called peripheral vascular disease. Sometimes your doctor might use this drug if you cannot tolerate aspirin. What are the doses of Clopidogrel? It comes in following doses: 75 milligrams and 300 milligrams. Most patients take 75 milligrams of Clopidogrel once a day. It can be taken with or without food. Everything you need to know before you start the drug. Tip 1. If you love grapefruit, you and Clopidogrel will not get along. Grapefruits and grapefruit juice can increase the chances of side effects, especially if you drink more than 2 or 2.5 cups. 2. Some doctors, especially in the hospital setting, check a genetic test called This to see if you would respond to Clopidogrel. If you are a slow metabolizer or have a gene variant, your doctor might suggest a different medication. 3. All drugs may cause side effects. I say it again, all drugs have side effects. The goal of this channel is to educate you if you are on a drug and how it works and what you might expect in terms of common side effects. There will be always some people who have no side effects or only mild side effects. If you do have side effects, call your doctor as soon as possible to get advice accordingly. 4. This drug thins your blood. You're more likely to bleed or bruise yourself. Be careful to avoid injury, or even if you fall down, do not hit your head. When you're brushing your teeth, use a softer bristle and take care when you're shaving. Your doctor, once in a while, will check your complete blood count, and he or she will be looking at your platelet count, your hemoglobin, and your hematocrit values. 5. If you're actively bleeding, like for example, a bleeding from a stomach ulcer or a brain bleed, your doctor will have to stop this medication. Number 6. You would be at an increased risk for a bleed the older you get, especially if you're older than 75 years old. Also, you're at a risk if your body weight is less than 130 pounds or 60 kilograms. Another risk factor would be after surgery. Number 7. There are certain medications which can increase the risk of a bleed. Examples would be warfarin, which is another blood thinner, and non-steroidal anti-inflammatory drugs, NSAIDs for short, such as Motrin, ibuprofen, or naproxen. 8. If you have to undergo a procedure such as placing a cardiac stent, your doctor will place you on aspirin and Plavix, depending on the kind of stent, for several months or even longer, usually 6 to 12 months. After 6 to 12 months of successful therapy, your doctor should discuss the benefits versus risks of continuing therapy. If you're interested in side effects of blood pressure medications, click right here. 9. If your blood in your urine, black tarry stools, or bloody stools, or if you cough up blood, or your vomit looks like black coffee grounds. These can be a sign of a life-threatening bleed. Call your doctor as soon as possible or go to the nearest ER or hospital as soon as possible. 10. A serious blood problem called TTP, also called thrombotic, thrombocytopenic purpura, can happen with this drug. This is a blood disorder where blood clots form in the small vessels of your body. This can lead to a life-threatening situation. Your main symptoms for TTP would be neurological symptoms, which are confusion, slurred speech, difficulty thinking, headache, and seizures. Symptoms of anemia, which are fatigue and weakness, shortness of breath, being off balance, fast heart rate. Skin symptoms like bruising, purple spots in your mouth and skin, yellowing of your eyes. GI symptoms like nausea and vomiting, stomach pain, abdominal pain, and diarrhea. Kidney symptoms like difficulty urinating, decreased urine output, and even a pinkish urine, and signs of a blood clot with sudden numbness or weakness affecting a part of your body. 11. Here's a list of some of the common side effects. The list is by no means exhaustive, but you have a general idea of the most common side effects. Call your doctor if you're experiencing any one of them. 12. Your doctor will ask you to stop Plavix about 5 days prior to a surgical procedure to minimize bleeding risk. You might be on a pill to protect your stomach, such as omeprazole. Omeprazole belongs to a family of medications called PPIs, proton pump inhibitors. There are some studies showing certain stomach protection medications such as omeprazole or esomeprazole at the same time as Plavix would diminish the effect of Plavix. However, there are also other studies who say the contrary. I generally recommend my patients to use pantoprazole if they choose to be on a PPI to protect their stomach, or an H2 blocker such as famotidine. 14. Here's a list of some drugs that Clopidogrel can react with. Once again, by no means exhaustive, but I'm pointing out some common drugs, such as this, or this, or this, or this, and lastly this. I did it before the battery ran out. I forgot a record. Oh my God. I was so busy setting up the camera and I forgot a record. What a waste of time. There's so many videos and I still can't figure this out. The remote control is not working. Oh, I didn't put it on. Does it work? Oh, connect. It says connect. Hopefully I don't have to do the whole video again. Please make this work. Please make this work. Yeah! Yes, it's working. Hurry up, faster. If you check my last video out, I was having problems with my phone. Now I got a new phone. Oh, battery's running out.